Hello guys, Dr. Qureshi here with you, and today I will be talking about blepharitis. Blepharitis, as you remember from my previous videos, is inflammation of the eyelashes. So your eyelashes can get crusting, which is known as blepharitis. Those crusting can go inside your eyes and can lead to inflammation, such as conjunctivitis. So we need to treat the root cause of the problem, which is blepharitis. So in order to keep the eyelashes really clean, I recommend these lid scrubs, which are known as OcuSoft lid scrubs, as you can see in the picture. Actually, it says it cleans, it comforts, it refreshes for soothing relief. So these are very, very important. And when you open the box, obviously I give these as samples to my patients. They come individually wrapped like this. So I can give maybe a few to my patients so that they can later buy them from over the counter, and they're readily and easily available at Walgreens, Walmart, CVS, pretty much all pharmacy brands or pharmacy locations. So these are known as OcuSoft lid scrubs, and I'm just going to demonstrate it to you. So I'm going to open it. These are very important for removing your eye makeup also because they are medicated lid wipes. So you open it like this, it comes out like this, and you see what it looks like. It has the chemical on it, but it doesn't burn your eyes. So that's the best part. I sometimes use these to remove my mascara with also, or even my eyeliner. So what I recommend, obviously the instructions are written on the back of this individually wrapped packaging like that, but you just wrap it around your finger. So I use my index finger, for instance, and then just like you do circular motions on your face to do the facial scrub, women can relate to that and some men can also relate to that, but you just uh, in gentle circular motions you're going to scrub your eyelashes with. And when I say scrub, obviously you're going to be very gentle because this area around the eyes is already very sensitive. So when you wrap it around your index finger like this, and then you can just scrub it gently in circular motion. So what I say to my patients is that they can use it 2 times a day, in the shower in the morning and then at nighttime before going to bed when they take off their makeup. Obviously it's very important to take off your makeup because if you leave your makeup on your eyes or on the face for that matter, you can clog the pores, and with the eyes it can lead to infections also, especially if you leave your mascara on your lashes and go to bed. I'm sure you feel that weird feeling when you wake up, and sometimes that irritation can also turn into a full-blown infection. So take off your eye makeup. These are very important for taking off the eye makeup also, but they are used for cleaning your eyelashes. So I recommend these, like it says, it cleans, it comforts, and it relieves and soothes and refreshes the eyelid area. So these are known as OcuSoft lid scrubs. This is the original brand that I'm showing you right now. Then there's another brand, or the same brand but a different product that this company has made, and this one is, and as you can see on the box it says professional samples. Right there on the top, right there, it says professional samples, not for resale. But these are the ones that I'm giving away to my patients in the exam room, but of course you can buy them, like I said, from over the counter from any pharmaceutical or pharmacy. So now the second type that I'm going to show you is called OcuSoft lid scrub for allergy. So remember, this box that I'm showing you is for soothing, refreshing, and it can be used in patients with dry eye problems. This one in particular is known as OcuSoft lid scrub for allergies, okay? So this one is for allergies, and again the packaging is pretty much similar. It comes individually wrapped. You open it. I'm not going to open this one now, but you open it and you do the same thing. It's called leave-on formula with tea tree oil. Now this one is very important, and why do I pick and choose different types or different variations for the same brand? Basically because if a person comes in with allergic conjunctivitis or allergies in their eyes, or they have a condition which is known as Demodex mites in their eyes, yes guys, there can be mites in your eyelashes also. That's why it's very important for having a perfect lid hygiene, keeping your pillow covers very clean, keeping your towels very clean. Whatever you're using that's coming close to your eyes, in contact with your eyes, you gotta keep it very, very clean. So these are used for that condition. They have tea tree oil in them, And a lot of people would know tea tree oil is used even for, and dermatologists would agree with that. They are used for patients who have very sensitive skin, which is acne prone also. So remember, this one is also an eyelid cleaner or cleanser for allergic or allergy sufferers. So this one is particularly for allergies or mites or Demodex mites because it has tea tree oil in it. And the other one was just for soothing, so probably for patients who have a general dry eye problem or blepharitis problem. Now the third one that I'm going to show you is called OcuSoft Plus formula. It's also a lid scrub, which is an eyelid cleanser, but it has extra strength. So you know how the companies always want to make something that is extra, like, you know, extra formulation or extra this or extra that. So it's called the plus formula. And why not? I like anything that has something extra, which is extra beneficial for the eyes. So this one also says it soothes, it relieves irritation, and it removes contaminants. So contaminants is like pollutants, like, you know, anything that is causing irritation to your eyes. And this one is extra strength just because it has a lot more ingredients that are going to help you, and it also says is #1 doctor recommended brand, which I actually do agree with. The OcuSoft brands or OcuSoft products are just amazing, and I've given a lot of samples to my patients. As you can see, I have all these sample boxes in my exam room. And this one comes in this package. Again, they're all pretty much similar. They're very easy to open. You have this little opening area here, so you just tear it apart and you get that little product or that little cleansing cloth that comes out of it. So the reason it's called the plus also is because it does cause eyelid cleansing for moderate or severe conditions. So remember, the plus one is for added benefits, and it's causing relief for moderate to severe conditions. So normally when I have a patient with mild blepharitis, I give them this sample, this one here. When they have allergies, I give them this sample. And when they have severe blepharitis, I give them this one. So these are all basically used for cleansing their eyelashes, and I do recommend twice a day. If you can do it twice a day, you know, human nature, if I tell patients twice a day, they're going to use it once a day. So but at least as long as you're using it, that's very important. That's the most important thing, as long as you're using it. And women can use it for removing their eye makeup with also. So that was all about blepharitis. And sometimes I also, obviously depends on the severity of the condition, as I always mention in my videos. If it's severe blepharitis, then I treat them with an ointment also. Sometimes I use Maxitrol ointment, which is polymyxin, neomycin polymyxin dexamethasone ointment. So it has the antibiotic along with the steroid in it. And I normally recommend 1/2 inch ribbon to be applied to the affected area at nighttime, mostly because, you know, the ointment can go inside the eyes and can cause blurriness if you use it during the daytime. But if you use it at nighttime and then just go to bed, and then first thing in the morning rinse it with water or even clean it with soap, so that you do not end up having blurriness. And for blepharitis, I sometimes use the Maxitrol ointment in conjunction with all of these lid scrubs, so that, you know, they're doing it manually with the scrub, scrubbing the eyelashes, and then also using the ointment. And sometimes I also prescribe them drops also, but most of the times ointments work really good. And also remember, the motion should be circular motion, gently, just like you scrub your face, you can scrub your eyelashes also. These are very beneficial. Every patient, almost every patient I have given these samples to, they have come and told me that, doc, they really worked, and then they start going and buying them. And I'm trying to see if there's anything else on the packaging. It says here on the original one, it says rinse thoroughly, repeat for other lid. So some of them, okay, so this is kind of tricky because some of them are supposed to be used and then you do not have to even rinse them. For instance, the one for allergies, it's something that it's pre-moistened pads, individually wrapped, and you just leave it on your eyelashes. I'll read the directions just to be making sure that everything is correctly mentioned in this video. So on the original one, like the one here, the directions say unfold pre-moistened Pre-moisten pad and wrap over finger, like I showed or demonstrated to you. Close eye and gently cleanse lid using side-to-side strokes or circular motions. Do not touch eye directly, obviously you're not touching the cornea or the conjunctiva. And then it says rinse thoroughly and then repeat for the other lid. So this one is recommending rinsing it, so that's important to know. Now the second one that I was talking about for the allergies, the directions are also, let's say, so unfold the pad or the packaging and wrap over finger, close eye and gently cleanse the lid using side-to-side strokes. Do not touch eye directly. Repeat for the other eye. Leave on for best results. No rinsing necessary. See how important it is? So that's why it's so important to read the instructions and the directions. So the one for allergies, or the one that has the tea tree oil in it, and that makes sense because tea tree oil, the more it is sitting on the lashes, is going to be causing a long-term effect, right? Like throughout the day, so, or throughout the night if you're using it at nighttime. And the important thing is they're not saying do it only at nighttime or do it only in the daytime. It's just saying just use it, right? So no rinsing is necessary for this. That means that if you still want to rinse it, sure, go ahead, but it's not necessary for this one. However, the original one, DocuSalt Lid Scrub, the original formulation, does recommend rinsing it. Now let's go to the third one, which is the added benefit one, which is the plus, the extra strength one. As you can see on the box, it says extra strength on it. So this one has directions for use, which says first wash and clean your hands. Obviously that's very important and mandatory. Close the eye and gently cleanse the lids using lateral side-to-side strokes. Rinse or leave on if directed. Avoid touching the eye directly. So it's okay. This one you can use it and then rinse it or keep it on the lid because it's just a chemical formulation that's going to be on the eyes, and it doesn't burn. I can tell you it does not burn because I have used it to remove my mascara with. If I apply a lot of mascara, like if, for instance, if I'm going to an event, I have used it to remove my mascara with, and it does not burn your eyelashes. That's why it's so important to use it, because if something is burning your eyelashes, patients are not going to use it. So this one, the extra strength, you can either leave it or rinse it after using it or after scrubbing your eyelashes with, but the original one, you definitely need to rinse it. And then the allergy one, you can leave it on. Okay, so you don't have to remember it, you do not have to memorize it. The instructions will be written on each packaging also. Like if you look on the back part of each packaging, the instructions are written on there. So that's all about blepharitis, and if you have any questions, feel free to ask me. I have mentioned blepharitis in some other videos also, for instance in my general dry eye videos as well. All right guys, you have a great day, rest of the day. Bye.